reduction, that 1/3 reduction in premature mortality. And at the same time, we know that 74% of all global deaths is actually due to NCDs. And you know probably as well as me that cardiovascular diseases is on top with 32% of those deaths. And I think all of us also know that we have tools available. We have had them available for a long while. It is in the menu of policy options, which is also now updated again, presented to the next executive board of WHO. We have packages. We have a very good civil society engagement. We have more and more multi-partners coming into the space. And the good thing is that we even have more funding coming in, and we have interest both from the Global Fund, the World Bank, but we need to express demand. So the aim of this gathering is that we want to institutionalize, as we did now for the first gathering of head of state, that we can convene multi-stakeholders in support of the heads of states and government to achieve the targets, and also to use what they have put in their NCD Global Compact to engage, accelerate, invest, align, and account. So I'm extremely pleased that we have so many people that in such a short time frame accepted to come and illustrate where we are. And I don't want to prolong this intervention. I want, although, to tell you that I have to send the warmest regards from Dr. Svetlana Axelrod, who was going to give the next intervention, but unfortunately she is on sick leave today. But we owe her a lot of gratitude, because it is really thanks to her and the GNP department and executed by Dr. Guy Fons from the Global Coordination Mechanism that we have been able to provide this platform today. So with that, I think I give the floor back to you, Katie. Thank you very much.
Thanks very much, Bente, for setting the scene there. And as we know, another really important stakeholder in the NCD response is people living with NCDs. And so let me now pass over to Poonam Bagai, who is the founder and chairman of KidsScan, excuse me, as well as the vice chairman of Pallium India and a person living with an NCD. So over to you, Poonam.
Thank you very much. I'm really pleased to be here today for this multi-stakeholder gathering for the Global NCD Compact. I want to share with you my story. In November 2000, living in Warsaw, Poland, I was diagnosed with stage 2 colon cancer. The year that followed, with surgeries, chemotherapy, a colostomy, living in constant fear of dying, leaving my 2 young boys motherless, pushed me into deep, dark depression as well. But with good treatment, care, and support, I recovered, both physically and mentally. It resulted in a pledge to go back to India and to help every child with cancer who did not have the privileges I had. Formerly an officer of the civil services, I was able to set up and grow KidsScan as a National Society for Change for Childhood Cancer in India. And today, Kids partners with over 125 cancer centers across 53 cities of the country. We have formal relationships with 6 state governments as their knowledge and technical partners. We have directly supported over 65,000 families of children with cancer across the country over the years. Central to this journey has been a multi-stakeholder approach, which includes governments, academics, NGOs, healthcare providers, institutions, professionals, and healthcare workers. But importantly, it has also been a journey of meaningful patient engagement. The one thing that really fills me with the greatest pride is that we have been able to bring often marginalized parents, their children, and survivors from lesser privileged backgrounds to the stakeholder table. Having learned from the world's leading organization of parents associations Childhood Cancer International, who presented us a "You Are Not Alone" manual on how to set up a support group when first I started. Today, we have 2 large parent and survivor groups. We train them, empower them, and help them to be patient navigators and patient advocates. Many of them are even able to get employment after training. So we have truly integrated our individuals with lived experience at all levels of interaction. Several of them have spoken at national, regional, and international platforms. Importantly, in all CanKids engagements with state governments, it is the childhood cancer survivors and our parent members who pin gold ribbons on politicians and bureaucrats. They seek pledges for childhood cancer to be a child and health priority in India. They conduct flash mobs and lead awareness and access to care rallies. They have learned to raise their patient voice, and it is gratifying that they are heard and they are respected. Individuals with lived experience hold crucial insights and expertise to participate, co-create, contextualize, and improve related programs, policies, and service delivery. Every such individual who makes it to the stakeholder table and engages meaningfully is truly committed to the cause and willing to put in an enormous amount of time and effort, often voluntarily and often with no compensation whatsoever. And that, I think, is important takeaway for everyone. The meaningful engagement of lived experience voice across NCDs and mental health conditions are catching up with other health agendas. And I want to say this, we are here to stay. We are enthused by the commitment from the global group of heads of state and government to explicitly show progress on the meaningful engagement of people with lived experience as one of the 5 commitments of the Global NCD Compact. I ask, we remember that for every family coping with someone with a non-communicable disease or mental health condition, that in itself is a calamity, and that family's human crisis. Whilst we are working with WHO on bottoms-up approaches to tackling NCDs and mental health conditions that value and incorporate the expertise of those with lived experience of health conditions, we also require your leadership and macro approaches to ensure action is bold, sustained, and transformative. I ask, too, that there be clear mechanisms in all countries for building, strengthening, and including the patient voice, where it is ensured that individuals with lived experience, no matter where they come from, have their rightful place at the table. We require consistency and transparency when meaningfully engaged, alongside integrative, person-centered, and rights-based approaches, which we can ultimately deliver equitable contextual policies, programs, and services. I ask then for your support to level the playing field by transferring power to the people. The right to participate must be guaranteed through government commitment and support at all levels. It is this that will truly result in patient-centered health systems in all countries. We look forward to working with you through the Global NCD Compact and soon to be released WHO framework for meaningful engagement. The voices of people with lived experiences are important and must be heard. Thank you for valuing my lived experience and expertise and for listening today.
Thank you so much, Poonam, for joining us and for your leadership and for really setting the tone for this meeting and emphasising particularly the focus on meaningful involvement. This is not just about involvement per se, it's about meaningful involvement and seeing people living with NCDs as experts in their own right. So thank you for that. So with those opening remarks in mind, let me provide everyone with a little bit of an overview of how we're going to be running the next 90 minutes or so. So the agenda is divided into two. We're going to be starting each part of the agenda with a case study from a government champion who has been very much part of this global group and the Global Compact. That will be followed by a panel of stakeholders to reflect on these examples, to share their own country examples, and also to be sharing, as I mentioned at the beginning, their specific recommendations and asks for how this global group of heads of government and heads of state can be maximised and utilised for the NCD response. And after each of those sessions, we'll have some time for Q&A with the audience. And I would encourage everybody on the panel and our government speakers as well to be really aligning their interventions with the 5 action areas of the Global NCD Compact, which, as I mentioned earlier, engage, accelerate, invest, align, and account. Just a couple of quick housekeeping points in terms of logistics of this event. We do really want it to be as interactive as possible. So at any point, you can add your question or comment into the chat facility at the bottom, and we'll try and weave those questions or comments back to the panel at 2 different points in the agenda. And also when we come to Q&A with the audience, if you do want to say something, please raise your hand and we'll try and get to as many as possible. Also, just to mention that the meeting is being recorded. And at the end, what will be one of the main outputs of this event is a summary report that will be written up based upon the discussion and key points we've heard, and will be shared with the global group of heads of government and heads of state. And as Bente said there at the beginning, this is really the beginning, and we're really trying to ensure that there is strong multi-sectoral engagement with this heads of government and heads of state group going forward. So with that, let me come to the first part of our programme, which is a presentation from our first country, which I'm very pleased to say is the Ministry of Health of Ghana, who have obviously been one of the leading forces behind, obviously, the international strategic dialogue, as well as the launch of the Global Compact. So I'm really pleased that we have today with us Dr. Martha Gayansa Luterod, who is a former senior health advisor at the Ministry of Health, as well as Mr. Barnabas Kwame Yaboa, who is the Chief Programme Officer for Nursing and Midwifery. So let me pass over to you both. I think you'll be sharing some slides where you'll be presenting a country case study and obviously reflecting on the global group of heads of government and heads of state. Over to you both.
Thank you very much. I think the current director is Dr. Bafwewa. If you can wave at us, it will be helpful so that we know we are doing this on your behalf. Dr. Bafwewa, wave at us, please. All right. Okay. Thank you very much. I thought you would say a word, but it's okay. Can I have the... Thank you. Slideshow, please. Thank you. I am doing this on behalf of the Director for Technical Coordination, and this is Ghana's NCD action and what we have been doing since the last ISD meeting. Next slide, please. The agenda is twofold, but various sub-themes. We have the Bente NCD initiative, which is sponsored by the government of Norway, and then the political commitment for NCDs, which began with a strategic national roundtable dialogue on NCD, followed up with an international strategic dialogue, and then the first gathering of global group of heads of state, which happened on the 21st of September 2022 in New York. The Bente NCD initiative is a government of Norway support for Ghana's NCD prevention and control interventions. And when the roundtable was held, this was also launched. The key objectives are in about 6 areas. 1, the governance bit, the partnerships that ensures collaborative effects, And then service delivery, looking at implementation of services, health workforce, how do we build an NCD-ready workforce? And of course, medicines that oil the NCD programming, surveillance systems, building robust surveillance system for NCD, and of course, looking at implementation research, which hitherto has never been part of projects, because when you are implementing a project, you begin to see bottlenecks, but we are not able to handle them properly. And so this is a very apt addition to the project. Next slide, please. The impact framework are in impulse, output, the outcome, and the impact. Key areas of the impulse include how we reactivate the governance structures, multi-stakeholder governance structure, and again, how we build our partnerships. We saw that when we did the roundtable conference, and we are building on that. Then we looked at the development, dissemination, and implementation of guidelines, and capacity building for the health workforce. Then the outputs will have to do with the NCD prioritize and finance. And when we come to some of our service programming, we have changed a few things and added NCD to our service delivery program. We thought that one of the key outputs would be a sustained partnership, not just a hit and run partnership, but a partnership that can lead us to the next level. And again, quality of our services, especially at the primary healthcare level, and improving access to medicines. And at this point, I will just urge that the NCD department begin to engage. I know you have started that with the medicine patent pool to see how NCD products can also be prioritized within the space of what countries are doing, so that international actions can support local actions. And again, key outcomes have to do with we are very ambitious, wanting a 200% increase in NCD services, and of course, sustained resourcing and support for NCD prevention and control. The key impact has to do with the fact that we see reduction of NCDs in Ghana. So what our strategic targets and scope is quite broad. We want to improve service coverage for hypertension, diabetes, and cancers. And we are looking at national prevalence of hypertension as 18.6. We're looking at technical issues on hypertension, diabetes, breast cancer, geographic issues on primary healthcare, around 270 health districts in the 16 regions of Ghana. But we are beginning with 6 districts in 6 regions. We have a target population, we have the health system issues. And so if you look at our strategic targets and scope, it just dovetails into the compact actions. Next slide, please. So what has been the progress? The progress has been that we have had a multi-sectorial NCD committees that have been revived. We have an NCD policy that has been endorsed and launched, and we have a multi-sectorial NCD plan with budgets. We have a UAC benefits package review that includes NCDs. We have diabetes guideline also finalized. District implementation is going on in 3 districts. And of course, we have a new set of NCD indicators defined properly now. Next slide, please. You can see some of the photos of the launch, and you can see the director and our sector minister doing the launch. Next slide, please. So we had a strategic roundtable on NCDs, and that is our political commitment for NCDs. And the key objectives of the strategic roundtable are just about 5-fold: awareness creation, ensuring sustainable financing, launch the NCD policy and the Kente program, as well as the strategy, and ensure that we have the strategic partnerships that support the NCD work. And of course, provide avenue for partners to discuss sustainable support for NCDs. Next slide, please. So you can still see the National Strategic Roundtable in pictures, and yours truly, my friends from WHO are all had been part of it. Next slide, please. So what do we mean when we say the meetings? We had the meetings, beautiful meetings, but those meetings must translate into action. And you can see the partner dialogues with Ghana Health Service and the PATH, Medtronic Labs, pharmacists. Those are the photos you are seeing on the screen. And then there was a field visit to implementing sites of the Kente initiative, and they are just beautiful to see. Next slide, please. So that dovetailed into the International Strategic Dialogue on the 12th of April, 2022, hosted by His Excellency, the President of Ghana, the Prime Minister of Norway, and the Director General for WHO. And the key objectives had to do with raising the priority on NCDs by lifting NCD issues to the highest political office, and then bring together national and international actors, and of course, raise the political visibility of heads of states and governments in providing leadership for NCD work across the globe. And so these are the speakers at the various, the ISD meeting, the International Strategic Dialogue, to suffice to say that over 1,000 people plus were viewing online, and 200 plus people attended in person. We had messages from heads of states from Thailand, Timor-Leste, and Barbados. And of course, First Ladies of Ghana, Congo were there in person. And we had messages from Belize and Bahamas. And then we have the message from the Global NCD Ambassador, Michael Bloomberg. Next slide, please. So key outputs from the International Strategic Dialogue had to do with the fact that once the dialogue takes place, what should be the next step? We agreed that we have a global group of heads of state on the sidelines of the UNGA in September, which actually happened. But before that happened, we launched the Global NCD Compact at the ISD meeting. And again, we are envisaging that national strategic roundtables will happen in almost every country, and with follow-up actions. We also envisage that we shall have a global First Ladies network on NCDs and up, because we also know that our heads of government can be busy, but their First Ladies can be very useful to drive the process. And luckily, we have the first gathering of heads of states in September 2022. So from commitments, what do we mean by the launch of the Global NCD Compact? We are saying that we want to save lives of 50 million people from dying prematurely. We also want to protect lives of 1.7 billion people, with NCDs during humanitarian emergencies. We saw that during COVID, that people with underlying conditions are the worst hit by COVID. And so it is just very proper that these actions are taken to support NCD work. We also thought that cover all people with quality essential health services and medicines, which are very key. And of course, make sure that we cover countries with comprehensive NCD surveillance and monitoring actions. And of course, meaningfully engage 1.7 billion people living with NCDs. So that they become the champions to lead the NCD work as well in the communities. And so these commitments might lead to actions of engaging, action of acceleration, actions of investing into the NCD space with resources, human, technical, as well as finances, aligning our actions to ensure that we are getting value for money and become accountable and responsible for the work of the NCD work, especially with the Compact. So, with the launch of the global group of heads of states of governments, we thought that it's an initiative that political leaders are intensifying their efforts to deliver on people living with NCDs. And of course, it is not obligatory. It is an informal, voluntary, and collaborative arrangement. It's a collective effort, and ownership is by operating with the 28th Political Declaration of the UNGA, and of course, inspiring bold political choices and commitment on NCDs and promoting WHO best practice. How do heads of government join? Any head of government can join the global group of heads of state, and we want to urge that the member states will be actively engaged in the process of creating ownership of this particular work. We also thought that governance must be in place. Luckily, our government, our president was the first chairperson for this annual meeting of group of heads of state, and we are happy he was able to do that. And again, we also expect that 2023 we must have the next one, and we are in expectation that since Norway began this work with Ghana and WHO, the mantle will fall on Norway, but we are still in conversation. And we also thought that regular reporting at the WHO and the UNGA are very important, especially if we want to monitor what is happening at the NCD space. Next slide, please. So the first gathering, you can see our heads of government smiling broadly. And I wish I was there to see what they discussed, but obviously we saw the photos and we knew that at least political leverage had been given to them. And the key objective that was why the program was held, had to raise the priority. We want to give visibility to NCD issues. We want to deliberate on the Global NCD Compact. We want to see how we can leverage the collective and inspire and support global actions, and that discussion must take place. I want to say that future events are also, I think we have done this already. The UNGA has taken place, and it took place in the Plaza Hotel and chaired by the President of Ghana. Next slide, please. And these are the program for the program that was held at the Plaza Hotel. There was a photo call, opening remarks by our president, and then addressed by the UN Secretary General, and the WHO Director General also spoke, and then launched the NCD advocacy publication and the NCD data portal, and renewed the mandate of Michael Bloomberg as the global ambassador for NCDs, which is a very good thing. And we are thankful to Michael Bloomberg for accepting to do that for us. And obviously there was a fireside chat moderated by a renowned journalist with the Bloomberg group. And of course, one of the areas was the selection of the chairperson for 2023, and there was a closing remarks. Next slide, please. So these are photos to tell you that it really took place in M Plaza in New York. Thank you very much for the attention. I hope I've not taken a lot of your time.
Thank you so much, Martha, for sharing both the progress that Ghana has been making at the national level, which is so impressive with the national strategic roundtables, as well as obviously the impetus that Ghana has given to the global NCD response through the international strategic dialogue, the global group of heads of government, and that global compact. I think in your presentation, you touched upon all 5 of the different aspects of the compact in terms of engaging, aligning, accelerating, accounting, accountability being so central. So thank you for that. Let me bring in our panelists for this part of the program. So we have with us today Chris Agbega, who is a member of the Our Views, Our Voices Advisory Committee, which is an NCD Alliance initiative. We have Helen Maguire, who's the Global Programme Leader for NCDs at PATH. We have Michael Calopietro, who is the Head of Digital Health Solutions at the World Diabetes Foundation. And we have Apurva Gomba, who's a young leader from NCD Child, as well as previously the International Diabetes Federation. So thank you all for joining us. And let me start perhaps with Chris. Obviously the experience from Ghana has been, truly multi-sectoral, as Martha was just highlighting there, in terms of a strong focus on partnerships. I wanted to ask you kind of your experience of that focus on engaging people living with NCDs within Ghana, how that's working, what are the lessons learned, and what would be your call to action to the global group of heads of government?
Thank you so much, Katie, and thank you everyone for this opportunity. I want to paint a picture because I believe that everyone is going to be hearing a lot of words today. But what I want to do is I want to paint a picture so that if for anything at all, you don't forget. Now, COVID hits and everything comes to a standstill. For me, as a person living with NCDs and looking at what the NCD community had to go through here in Ghana, I have to say that I don't think we are hitting the nail on the head as expected. And the reason I'll say this is because I remember during COVID when the medications that we were supposed to take, or the medications that we take on a daily, medications that are life-saving for us, skyrocketed and nothing was done about it. Also, access to the kinds of services we needed also came to a halt in certain sectors because, because attention was completely given to COVID and not persons living with NCDs. But bear in mind that we are persons with underlying health conditions. I'm not just speaking for myself, but I'm speaking for the community. I believe this creates a picture for you to understand the gap that has to be closed. That gap that needs to be closed in terms of engaging not just persons living with NCDs, but the organizations that lead the voices of persons living with NCDs. This is very, very critical. From the presentation, from the Ghana presentation, yes, a lot has been done. Of course, we have been a part of some of these engagements, but Katie, a lot can be done. A lot has to be done from the curation stage to the implementation stage. Persons living with NCDs need to be meaningfully engaged, and I'm not just talking about a meeting or maybe just a formal dialogue like I was part of during the first meeting here in Ghana with Ghana and Norway and WHO hosting. But what I'm talking about is on the ground, at the grassroots level where the people are. It is important that persons living with NCDs like myself are part of the implementation stages. We've seen the NCD policy, and we must admit it doesn't comprehensively address the issue of meaningful involvement. We saw all the pictures, but unfortunately, I didn't really see pictures that really sent that message that yes, indeed, these are persons living with NCDs. These are persons who are leading the conversation, and these are persons who are championing the cause of meaningful involvement. That is what we want to see. So yes, we would acknowledge that the government is doing what it's supposed to do, but a lot more can be done. As a member of the Global Advisory Committee, just as you've mentioned, we've listened to other countries and what they are doing. We believe our country is also capable, and we believe other countries can also listen to this, take that step, and curb any other future occurrences like what happened during COVID. Because, Katie, I still have the pictures vividly in my mind. The mental stress I had to go through, the psychological strain, because you can't even go out because you're a person living with NCDs. There's fear, but all of these things we're just brushing aside. It is very important even as we move on. I am hoping I have painted a very, very good picture. Sometimes when I speak, I tend to speak from my heart and with a lot of passion, but I think that is the only way I know how possible, because at the end of the day, it is my life that matters. It is the life of other people that I represent that matters. So that is what we want to see, that engagement, that high level engagement that cuts across persons living with NCDs and organizations that lead the voices of persons living with NCDs. That is what we want to see. Thank you so much.
Thanks, Chris. We can always rely on you to paint a very clear picture, coming very much from the heart and from your experience. So thank you for that. Let me come to you, Helen, now. Helen Maguire from PATH. I mean, one of the other kind of core pillars of the compact is this focus on integration. and alignment. And obviously PATH has a huge amount of experience of integrating NCDs within other global health programs and services on the ground. Over to you in terms of sharing some of those case studies and some of the lessons learned.
Yeah, thanks very much, Katie. Very briefly, given the time. Of course, PATH is very committed to supporting the global group of heads of states and governments in their efforts to achieve SDG 3.4. And I will focus on the alignment through integration with the NCD agenda, but also the importance of engagement across sectors. And so I really want to emphasize, at the service delivery level, and this was reflected in Chris's comments that he made, people really need integrated and adaptive care driven by multi-sectoral engagement. And the global health platforms must allow for their funds to be used as part of putting people at the center of rights-based health system responses and recognize that people come with and multi-morbidities. So PATH has been working on integration for a number of years across cancers, mental health, hypertension, within some of the programs like malaria, HIV, TB, et cetera. And for example, I'll do a specific example to highlight some of the barriers. With the Kenya Ministry of Health, for example, and working with county governments funded by Resolve to Save Lives, we've established a one-stop shop approach for integrated HIV and hypertension care. So we built on existing PEPFAR HIV investments to strengthen hypertension screening and care to improve outcomes, and also leveraged the differentiated HIV care, self-care, use of non-clinical cadres for task shifting, and electronic medical records. And through a combination of that, we've been able to strengthen screening, retention in care, and improve control and viral suppression. What's been challenging as we've looked at this is a couple of things. I'll highlight a couple of things. We do need better simplified hypertension protocols and integrated HIV hypertension differentiated service delivery models. And integration breaks down when hypertension medicines, in this case, are not available. So screening is high, 90% screened, 20% newly diagnosed, emphasizing the importance of this integration. But when we hit treatment and control, it's very negatively impacted, of course, by the lack of medications available within the system if you're building off an HIV platform. And then, of course, the need to unify data capture and monitoring tools and measure cost effectiveness. So really looking for that strong influential voices of the heads of states and government, coupled with coordinated multi-sectoral action, to ensure that NCD integration goes beyond these strategic aspirations at the global level, but the integration is happening all through the system and is financed with clear targets to provide integrated, adaptive, person-centered care. And then just to take one more moment is to think about that and reflect back on the presentation that was provided on the Ghana case study. What drives behind this is really be able to coordinate and have mechanisms for strong and inclusive engagement across sectors in a really coordinated response. So critical to achieving this effective engagement is having an accessible source of data and information on the NCD response at the national and subnational level. It's really necessary that we illuminate the gaps and opportunities to better meet the needs of people living with NCDs. And so working with MOH, with the NCD department, but also with the health information departments, local stakeholders, and this was funded by Access Accelerated, we've been establishing the NCD Navigator across 5 countries, and it's proving effective in informing strategy and resource allocation, coordinating stakeholders and responding to unforeseen events and stressors. It supports that evidence-based decision-making that's needed, providing a source of information and data to support heads of state to engage with stakeholders across sectors, to target actions and to monitor their progress towards achieving their commitments. So this, the strong influential voice of the heads of state group to mobilize resources for integration of NCDs to achieve that alignment, but also couple this with mechanisms to efficiently engage multi-stakeholders, I think will really position us for great progress. So there's lots of opportunities for integration. We still need financial investment for that. And there's some critical pieces of the pie that need to be solved for access to medicines being a core one within our integration efforts. Thank you for this opportunity to share with you.
Thanks so much, Helen, and thanks for combining both the integration and alignment piece of the compact, as well as the focus on investment and financing. They're both so completely interlinked, as you say, and the opportunities of, really unlocking integration needs to happen at all different levels, whether from a governance perspective, whether service delivery, as well as financing. And I think that the NCD Navigator tool is a great example of how we can ensure that we know what different stakeholders and initiatives are happening within the country, and ensuring that we're connecting the dots and leveraging all of those efforts rather than duplicating. So thank you for that. Let me move on to our third panelist, who is Michael Pietro. Apologies if I haven't said your surname quite right. Thank you so much for joining us. You're the head of digital health solutions at the World Diabetes Foundation. And as we know, within the compact, another focus is on accountability, and obviously accountability needs strong surveillance systems, information systems to provide data around what's working and what's not working. So could you share some examples of WDF's work in strengthening health information systems in certain countries for NCDs?
Thank you, Katie. You did a good job with my last name, so appreciate it. And thanks to everyone who's presented today, and specifically to Martha. It's really nice to see the ambition and the objectives of the program that she presented. I think a lot of what I'll talk about will fit nicely into that, but particularly focus on accountability or accounting, as you mentioned, Katie. I'd like to highlight a specific initiative that the World Diabetes Foundation is working on in 3 countries, Sri Lanka, Tanzania, and Malawi. Within those 3 countries, we have been working on something called the Diabetes Compass Initiative. It's a collaborative approach. We don't work alone in each of those countries. We have coalitions of partners ranging from ministries of health, both NCD divisions, as well as health information and ICT divisions, also broadening out into the NGOs and other society associations. So while I'm presenting it today, it is the reflection of the work of the collaboration that happens across these organizations in country. The Compass is really about digital health transformation. It focuses on 3 big components. One is strengthening NCD health information, capture, transfer, and use, which is what I'll focus on today. But it also includes the extension of using technology to extend services out of facility into community, things like screening, for example, using unified community health platforms and integrating that with other community-based services in those platforms. And then lastly, we're focused very much also on using technology to support HCP learning and point of care performance, so decision support. But I'll focus very much on the health information space today, Katie. And what we're really trying to do in that space is to strengthen the health information value chain, data value chain, focusing very much on first facility level and community level capture. So what that could look like in practice, for example, in Tanzania, is the most people with diabetes and hypertension are currently managed in an EMR environment that is in an outpatient record. So it's unstructured data, it's a lot of free text, and so what we're working on with the ministry is to build a microsite for the direct provision of the clinical care component of diabetes, hypertension specifically. You get structured data, you get quality checks, you can do clinical decision support. There's lots of things that you can do when you do a micro module within an EMR environment. And that will be rolled out to primary care facilities. In fact, the EMR is already in 30% of those facilities today. So the microsite will just be an additional component to support care, but also to support data capture. That information we're also working on then is getting it out of facilities in an efficient way and into case-based environments using Tracker, which is a DHS2 platform that's been used widely in HIV, tuberculosis, maternal and child health. So how can we use Tracker to start case-based tracking, anonymized case-based data, if you will, for NCDs? And the third component of that is then to be able to use the data, the aggregate data that is in Tracker, the case-based data that's in Tracker, and then to aggregate that up into what will be the first ever in these countries, NCD data warehouses. And we have run the process together with local partners of defining that indicator framework for the aggregate data across all NCD areas. And we will be supporting them in building that in DHS2 together with ministries, the Ministry of Health Information units, as well as the health information of the HISP nodes in those countries. So at the end of, and then the last piece is that it's not enough that we just deploy technology to capture, transfer, and store information, but that we really focus on building cultures of data use. And so we've been working very closely with local partners to define priority use cases at the facility level, subnational and national levels, and really working on building those cultures, or we will be working on building those cultures of data use, so that when the data is there and in good shape, good quality, that they also have the practices to support their use. And again, this is spanning not just diabetes, hypertension, but the warehouses will be for all NCDs. So yeah, thank you for allowing me to share what's going on. Appreciate it.
Thanks a lot, Michael. And yeah, really great to hear the progress around health information systems. And I guess if we've got time, it would be really good to circle back and talk a little bit about, what could we be asking the global group of heads of government or heads of state to be doing around kind of strengthening accountability and data and information systems as well. But let me come to our final panelist for this part of the programme, who is Dr. Apurva Gomba, who is a young leader with NCD Child, a physician, lives with type 1 diabetes, and has also been a young leader within the International Diabetes Federation. And Apurva, we heard from Chris, obviously, around the importance of engaging people living with NCDs, but wanted to ask you around, kind of concrete examples and lessons learned of engaging youth within the NCD response as well.
Thank you so much, Katie, and thank you, everyone. Thank you, Martha, for sharing such an amazing presentation from Ghana. I just want to leverage from Chris' comments that a lot has been done and a lot needs to be done. And there are wide implementation gaps which are continuing to exist at the grassroots level. Today, I feel I'm privileged as a young person who, with a lived experience, having an opportunity to share this collaborative, collective efforts that we've all been working on. Yes, we can set ambitious targets, but the implementation gaps are still looming on our heads. As a youth representative from the NCD Child, I would like to reiterate that young people play a crucial role in developing, implementing, and evaluating the national efforts to achieve SDG 3.4. And we have to go beyond the traditional roles of advocacy. Now, to account these collaborative solutions at NCD Child and in pursuant to the commitment 4, there have been I would like to share certain examples of the effective proactive work we've been doing at NCD Child. For a long period of time, early life prevention has been neglected from the global health policy agenda and financing. Now at NCD Child, we have two classic examples to share: the development of evidence-based resources related to NCD prevention and control in children. NCD Child is currently working on global burden of disease dashboard that would help in providing country and regional snapshot of child adolescent specific data to inform programs and policies at the grassroots levels. Secondly, to account the challenges of access and the amount of work in the diabetes space, we recently worked on a scoping review where I was a part of the team of NCD Child, where we shared about that 100 years since the discovery of insulin, the global progress of type 1 diabetes in low resource settings has wide implementation gaps. And this review has been published in the Lancet. So for everybody who would like to read more about it, should feel free to read it. The other aspect, pursuant to the commitment 5, to meaningfully engage 1.7 billion people who continue to live with NCDs and mental health conditions, one of the key strategic pillars at NCD Child is to identify, build capacity, and provide professional development to these youth advocates, people like me, to ensure that we can meaningfully engage and continue this engagement in global, regional, and NCD spheres. Some of the work at NCD Child has been to be working around the scoping review for identifying packages for NCD interventions for ages of 0 to 18 that have been integrated at school, healthcare, community, and at all digital platforms. And these are cost-effective, practical strategies that can be implemented at all country levels. And we could see some of the examples as shared by Martha from the Ghana case study. Now, school plays a real crucial role in NCDs. Now, NCD Child has been working collaboratively in Latin America and has set up regional workshops to train regional and country advocates and empower these advocates for increasing the country level knowledge sharing and collaboration on school health strategies for NCDs. It starts from the beginning. Now, when we talk about prioritizing investment on these young peoples to strengthen the health system, we have to be critical in promoting equity in global action. I need to emphasize that geography should not determine access to care. we need to include, engage, and empower people from all strata and include lived experiences from all aspects of life, high resource settings, low resource settings. Youth participation and leadership in policy programs and governance have been an integral part of NCD Child's work, and we ensure promoting equity in global action to promote and support the lives of those living with NCDs. Now, one classic example is what I represent today, is the NCD's Child's flagship Young Leaders Program. And we've been working collaboratively towards effective leadership capacity, increasing engagement in NCD-related advocacy, and sustain a strong youth voice in this NCD landscape. Now, finally, as we address NCDs, we know it's a global priority, and youth will have a direct impact if no significant action is taken now during this critical window of opportunity. Now, people living with NCDs are equipped with this powerful resource of lived experience and well-honed knowledge sufficient for meaningful engagement. Now, this will ensure that not only our voices are brought on the table, but we meaningfully engage through this course of planning and as we move forward. Yes, we have an ambitious road to Global NCD Compact 2020-2030, but today's youths and tomorrow's leaders hold a potential unmet priority as we commit to support this global group of heads of state and government. As I speak on behalf of NCD Child, today I urge attendees to create a meaningful opportunities for youth engagement that are compliant with meaningful youth and adolescent global consensus statement. I would like to highlight what Mrs. Poonam started the meeting with, that this action needs to be bold, sustained, and transformative. It doesn't have to stop today. Specifically ensuring youth living with NCDs have the opportunities to co-create health system, change strategies. Now, how do we do that? Youth-led organization needs continuous support, funding. We need to identify key partners in project teams and ensure that youth have leadership roles in program design and implementation. We also need to cater to the youth living with NCDs who can serve as a potential resource and staff members in programs and budget management roles. Yes, it's a high-end role, and we have ambitious targets, but we also have ambitious youth living with lived experience. So that's what I want to close down this meeting with, that today, this is a key takeaway. We don't lose this resource as we talk about multi-stakeholder gathering. Thank you.
Thanks so much, Apurva, and yeah, for really underlining the importance of, you know, investing in and capacity building of youth leadership is so important, as well as the diversity and equity point that you rightly raised. So thank you for that. We also have, I'm going to now pass over to two leaders from Ghana to also reflect on the country case study that we heard from. I'll firstly pass over to Labram Musa. Labram, I think you're online, who is the coordinator of NCD Alliance Ghana and was very much kind of front and center of all of that activity around the April National Strategic Roundtable, and has been a really important partner to the government. So over to you, Labram, in terms of your own experiences of multi-sectoral action within Ghana.
Right, thank you very much, Katie. And let me say that I would like to also commend my own country and the leadership of Dr. Martha and the Ministry of Health in this space. Indeed, a lot is happening in Ghana, and indeed, Ghana in recent time has been, touted to be one of the leaders in terms of advancing, policy interventions on NCDs and also the SDGs across the globe. And indeed, let me also add that Chris and then others has actually nailed, the issue rightly. And to say that indeed, the Ghana NCD Alliance has been, part and parcel of most of these interventions that were highlighted by Martha as a Ghana case study. So I remember during the planning stages of the ISD, the Ghana NCD Alliance played a very critical role representing the civil society voices and people live NCD's voices as well. Indeed, I must say that a lot of recommendations were made on how to actually advance, the concept, and then also how the whole committee would adopt the concept of meaningful involvement and bring people living with NCDs, to play a meaningful part in the conversation, both the national and then the ISD. And indeed, those who witnessed, saw that there were that kind of reflection of people living with NCDs who had the opportunity to, share their lived experiences and also call how we can together integrate their involvement for the ultimate good of doing implementation of the compact. But unfortunately, some of the gaps, that my colleagues mentioned indeed is a reality which we indeed need to ensure that we are able to bridge, them. So for instance, I can mention that during the development of the NCD policy, for instance, in Ghana, the Ghana Netherlands, was part of the process, but unfortunately, we did not, as Chris mentioned, the concept of meaningful involvement, that aspect was not properly reflected within the context of the national NCD policy, which we have expressed our disappointment on that, because we sent a lot of proposals. But indeed, we were promised, or we were told that indeed the strategy plan, which is currently being fine-tuned, would try to address the aspect of meaningful involvement within NCDs, and then also the civil society and also the community. Now, I'm particularly happy because the WHO has adopted or has embraced the concept. So I think it will be easier for countries to begin to to also reflect. But I think that the WHO Global should continue to engage country level, the WHO, and then also governments into that. So at least we can all embrace the concept. With that, I think we will see the reflection of, the concept of meaningful involvement and the importance and the benefit that there is to countries and, and people live NCDs, as a whole. Indeed, let me say that beyond even what we have seen in Ghana, I can say that indeed Ghana have also moved a step further by integrating, NCDs, including the mental health within the national framework. So here I'm talking about the National Development Planning Commission that has the responsibility of developing Ghana's national plan, for instance, has incorporated, through our advocacy, and within their 5-year development plan, has incorporated, NCDs within that, looking at it from the context of the SDGs, and then also the other development document, which I believe that the Ministry of Health, it will help the Ministry of Health to actually, adopt and then help us to achieve the target that we have. And indeed, I must say that even Parliament has also, in recent time, has shown so much interest. I'm talking about our legislature, has shown so much interest in the NCD space. So for instance, after the World Health Assembly, for instance, the Ghana NCD Alliance were invited, to share our perspective on what we believe are the challenges or the situational analysis with respect to non-communicable diseases in the country. By extension, if you look at it from the regional level. I was there with Christopher Agbega, and like he said, there has been, attempts by the Ghana NCD Alliance to ensure that people living with NCDs are involved in many of these national discourse. So Christopher was there, and the moment he's beginning to share his lived experience, how he navigated the system, in terms of healthcare problem that he personally and other people living NCD faces with respect to, access to care, connecting it with COVID-19, it actually resonated with policymakers and even Parliamentary Select Committee on Health. So they have actually, pledged to continue to engage us, as we continue with the journey of NCD. Finally, let me say that there's a bigger challenge. And the challenge for me, I think, is that we need to deliberately have policies that will address promotional health, because to be missing in many interventions. So as for instance, on tobacco, alcohol, sugar-sweetened beverages, and then the missing one, which is air pollution, which is also eating, a lot, into the fabric of society and impacting NCDs. So we need to also reflect on that matter. I know a lot has been done on tobacco, for instance, courtesy the WHO Framework Convention Tobacco Control. But the rest need a lot of, a lot of fine-tuning, so that together we can make a lot of impact in this space. So I would urge that as of this, continue to, meet and deliberate on these things. I will urge that they should prioritize the concept of meaningful involvement, because that has been highlighted in the compact. So we need to see how we can reflect on that. And then I'm glad that the NCD Alliance Global, with its membership across the entire world, are also ensuring that the government is held into account, to ensuring that at least the things that they have spelled out within policy frameworks are actually being prioritized and are actually being put into reality. Indeed, I know we can make it. So let's all support this intervention. Thank you very much for your attention.
Cool. Thank you so much, Lebram. Great examples of what's happening in Ghana. And I think, as you say, important that governments are really providing the kind of enabling environments and platforms for true engagement, whether it's from civil society, people living with, as well as youth leaders, and that's so critical. I'm conscious of time. I also want to give the floor to Dr. Patience Kofi, who is the Ghana country leader for PATH. Patience, if you are online or could raise your hand, then we can give you the floor. Or I can try and come back to them a bit later as well. Okay, I'll try and bring Dr. Kofi in a little bit later. So I'm conscious of time. We're going to have to move on, but I just wanted to ask our panelists a quick follow-up question. Obviously, more questions are coming in the chat, and I'm going to try and get to some of them in the next round as well. But we had one question around how can organizations working on NCDs beyond the big five and big five risk factors contribute to the Global Compact and all of what we're talking about around the global group of heads of government, of heads of state? That's one question. And the other question I'll pose to the panel at this point is just to really try and summarize your calls to action of what the heads of government and heads of the state coalition could really be used for, picking up on the different themes that you've covered, whether it be engage, align, invest, account. So if all panelists would like to jump in, either addressing that first question or the second one, and then we'll move on to the next part of the agenda. Thank you.
Katie, perhaps I could start with an obvious kind of answer to the second question, which is, of course, when we're dealing with the idea of surveillance, monitoring, and the use of health information across levels, whether it's a facility, subnational or national, there are large infrastructure components to go around that make that sort of work as efficiently and as effectively as we would like it to do. And so I suppose I'm always advocating for the obvious, which is two things: greater investment in kind of infrastructure development within the digital space, and to prioritize investment in digital health more broadly, whether that's things like capture environments or into the kind of infrastructure that's needed to store and use data. And the second thing I would also be is to make sure that we also prioritize the development of skills to do good health information use, not just for monitoring and surveillance, but also for policy planning, resource allocation, and so on. So we tend to prioritize the building of often HCP skills, for example, and I think we also need to prioritize the use of skills, the skills that cultivate the use of health information for good. And I'll end there. Thank you.
Thanks a lot, Michael. Others from the panel? I also note that Patience has just messaged to say that she is online, so if someone from WHO could give her the floor, that would be great.
Hello, can you hear me, please?
Yes, we can hear you. Thank you.
Thank you. And thanks for the opportunity to give some highlights of what has been shared. And I would start by commending the Ghana Health Service and WHO team that has made this possible. And also to say that all the panelists have really touched on the issues that really nailed into it. The issues that have been bothering us, they've been very honest in their presentations. And I'm saying a big thank you to the team. I also would like to say that in trying to accelerate the response in Ghana, PATH has been able to work with the Ministry of Health and the Ghana Health Service, as well as other partners, to mobilize all the stakeholders that are in the space, the NCD space. And we've been able to do this through the navigator. And we've been able to so far mobilize over 100 stakeholders across the levels, from lower to the very high levels. And we have been engaging on our platform, which we set in the beginning, a WhatsApp platform, which has been very useful and getting almost all the partners to share their information on this platform. Labram, for example, is the one who uses it extensively. And I would say that it's just an evidence to say that if we have tools that are available for us, we'll be able to also make good use of them, and not only having stakeholders or the partners together, but we share information on these platforms, and we are able to start dialoguing on where the gaps that we have identified. In using the navigator, we're able to identify several gaps across the regions in the country. The tool has helped a lot by directing the planners, the policymakers, to know the areas where the investment should go, where the burden is, and where the areas where it is gray along the continuum of care. We think this has been very useful, though we haven't been able to match any outcomes yet with what we have done, but we think we are in the right direction, and all stakeholders, when we put our efforts together, will be able to achieve our individual objectives and the collective objective of our desired goal of reducing the burden in the country. That said, I must say that there are other challenges that we are still facing as a country, partners within the NCD space. The mechanism for engaging at a very high level, which is our steering committee, is in place, but it hasn't been very functional. And I would like to use this opportunity to call on our leadership at the Ministry of Health to help us to bring all these important stakeholders together, because this is the mechanism that will really help us to move up some of the recommendations from the activities that we are carrying out in the country to the policy level. There are several things that need to be addressed from the policy level, and we need their support. We also continue to use our navigator to understand, do more analysis to understand what is going on within the space where people are working. For example, we see that a lot of people are doing health promotion, but within the health promotion space, what exactly is happening? And PATH, with the support of the National NCD program, plans to do this. Also, we need the partners to really come together to do more analysis and understand specific roles that individually we can pursue to achieve the desired goals. We are still working as in silos. People will just invite you to their meetings and you contribute. We know through the navigator now partners who are in the space, but to what extent can we galvanize our efforts and to achieve the desired goal? And that is something that we need to work on. We need the steering committee to be very active so that they can help other partners, both from the philanthropic side, the business side, the private sector, the NGOs, all of us, including those from the civil societies that are working at the grassroots to be able to achieve the desired goal. I would say on that note that we in PAF are so committed to ensuring that we give the necessary technical support to the ministry and the Ghana Health Service, as well as our partners. But we also need funding to support all these efforts and be able to achieve our goal. Thank you.
Thank you so much, Patience, and thank you for sharing the experience of Ghana and where the progress has been made and where the barriers remain. I'm not doing an excellent time management job as moderator so far, so I think we are going to have to move on to the next part of our programme. But I did want to give the floor very briefly to Feng Zhao, who has just joined us as he's in transit from travelling, who is practice manager for strategy operations and global engagement at the World Bank. Feng was meant to be giving some opening remarks, but he's just joined now. So I wanted to give the floor to you, Feng, over to you. Okay, perhaps Feng isn't with us. Apologies for that. I thought he'd joined. So thanks very much, everyone, from that first panel, for Martha for sharing the Ghana example, and for Helen, Chris, Apurva, and Michael for sharing their perspectives. We'll now move over to the second part of the programme, which takes a similar structure to the first part. So we'll start with a country case study and one of the leaders within the global group of the Heads of Government and Heads of State Coalition. And then we'll be having some remarks from a panel, and I really hope we'll be having much more time for Q&A and for me to be able to share some of these questions that have been coming in through the chat facility so far. So now let me pass over to the Honourable Sonia Brown, who is the Minister of State for NCDs for Barbados, to be sharing country case studies specifically around sugar sweetened beverage tax within Barbados. Over to you.
Thank you so much, and good day to all, and thanks for the invitation. It is indeed a pleasure. So without further ado, let us begin. With a large burden, clear linkages to attainment of the Sustainable Development Goals and clear high-yield actions, it is critical that the world leadership engage in advancing the NCD agenda for itself and for its linkages to the wider development agenda. There's a likelihood that many countries on their current trajectories will not reach their agreed targets, including those related to NCD mortality. The group of heads of state and government for prevention and control of NCDs and the associated NCD Global Compact offer a mechanism for additional concrete commitment, accountability, and resource mobilization. Given that many of the drivers of NCD risk and burden are outside of the remit of national health authorities, it is key that heads of state provide support for effective whole of government approaches. As we look for ways to address gaps in achieving NCD prevention and control commitments, it is important that we understand and harness opportunities to accelerate action. The global group of heads of state and government for the prevention and control of NCDs has significant potential to advance the NCD agenda within the member states involved, as well as internationally. The experience in the CARICOM region, having had the first heads of government summit on NCDs in 2007, and having played a role in getting NCDs onto the agenda of the United Nations General Assembly, it is clear to us that these types of processes can yield results. While income per capita and the size of the country can impact implementation, the literature suggests that a major determinant of effectiveness of declarations of heads of government relates, at least in part, to how quickly and how often follow-up occurs. In the Caribbean, the clear targets and reporting grid have helped to document and advance action on the issue of NCDs. In this case study reflects on the work of an intersectoral, multi-sectoral mechanism that examined and reported on the potential of taxes to improve health outcomes related to sugar-sweetened beverages. It draws on published literature as well as policy decisions on sugar-sweetened beverage application and the intended role of multisectorial work. We reflect on existing and potential multisectorial action to advance the issue. Barbados is a high-income, small island development state with a population of approximately 290,000. The country is undergoing social and economic changes, having imposed a range of structural reforms under a 2018 to 2022 IMF program. Barbados has a record of seeking to implement regional and international NCD targets, including those coming out of the Port of Spain Declaration on NCDs. In 2018, the United Nations Interagency Task Force recognized Barbados for its policies related to nutrition, tobacco, and alcohol. In the 2021 report by Allen et al., implementation of 18 core NCD policies was assessed. The scores in the Caribbean region range from 9 to 1.5, with Barbados receiving a score of 7.5. Barbados is experiencing a heavy burden of chronic non-communicable diseases, which were responsible for approximately 83%, which is higher than the global average of deaths in 2020, with 66% of the adult population overweight or obese in the 2015 STEP survey, up from 54% in 2007. In the most recent global school health survey done in 2012, 75% of 13 to 15-year-olds drank one or more sugar-sweetened beverages every day. More recent samples, which were smaller, have found similar results. Current nationwide data on dietary intake and patterns are not available for Barbados. However, a recent publication in 2013, a small-scale study, found that the contribution of ultra-processed foods was significant. These foods represented 40.5% of mean energy intake. Sugar-sweetened beverages made the largest contribution to energy within the ultra-processed foods category. Younger people, 25 to 44 years of age, consumed a higher proportion of calories from ultra-processed foods compared to older people between 45 and 64 years of age. In 2015, the government of Barbados implemented a 10% value-based tax on sugar-sweetened beverages. Following the introduction of the tax, an evaluation committee was stood up to examine the intervention. The committee has features that demonstrate multisectoral action through engaging diverse range of stakeholders, catalyzing understanding of the impact of the tax, and producing knowledge products which promote accountability, engaging and accelerating. In line with the International Conference on Health Promotion in 1986, the work of the committee sought to, quote, put health on the agenda of policymakers, unquote. As a result, there was a need to engage with those who develop analyses that inform government budgeting. This was done by including both government and economic representation. There was also representation of civil society, technical assistance agency, and the government. Given the interest of each to understand the application of the tax, the working collaboratively leverage knowledge, resources, and combine strengths and expertise, reducing duplication among partners, increase efficacy, and accelerating understanding. On accountability, dissemination of findings through various channels has promoted accountability. The committee found that the 10% tax had been effective in addressing sugar-sweetened beverage consumption in line with the published literature and the WHO best buys, and that it was associated with increasing bottled water use. However, its impact had been limited due to its size and mode of implementation. These findings were disseminated as knowledge products through technical and policy channels, public information channels, as well as into the academic literature. In addition to outputs from the committee and its constituent members, aligned NGO partners help to disseminate messages from the committee as well as complementary messages based on commission work, including on public accessibility and revenue production estimates. Factors influencing the impact of multi-sectoral interventions. The effectiveness of the steering committee has been driven by a range of factors mentioned in the literature. There was a high level of health literacy of individual and partner agency members. There was strong technical ability to generate evidence on the health and economic implication of the sugar sweetened beverage tax. There was also trust among committee members and opportunity for participation and engagement. Regular reports were produced for internal use, and effective communication, including storytelling, were deployed in engaging the public and policymakers. The current situation. In April of 2022 this year, the Prime Minister increased the sugar sweetened beverage tax from 10% to 20%. Currently, stakeholders, including the industry, are being engaged by the Ministry of Health and Wellness with a view to eliciting a package of commitments for reducing sugar consumption. The steering committee is also being reconstituted to examine evidence in relation to the implementation and impact of the 20% tax. It is expected that its outputs will form a key input into the desire for further policy guidance that has been signaled. I now look forward to your discussion and input and of course your guidance. I thank you.
Thank you so much, Honourable Minister, for that great example of development, obviously, of the sugar sweetened beverage tax within Barbados, and then obviously the more recent increase in that tax and how different stakeholders have supported in different ways. And I think I would like to ask just a quick follow-up question to you in terms of how you managed to kind of safeguard the interests and pressure from the industry in developing your SSB tax, because that's obviously such an important part of this, kind of having clear safeguards, and that was a question that has been raised in the chat box.
Okay, from my perspective, yes, the 10% tax went on with the previous government, which was great, but it did not do what it had to do. With respect to this further 10%, which brings us to 20%, there are issues. The stakeholders, we're actually planning a meeting this month, in a couple of weeks, to discuss with the stakeholders, which include the beverage manufacturers, retailers, wholesalers, etc., to discuss the ways forward in terms of implementing this sugar sweetened tax to make it meaningful to the population. Therefore, we want to bring in discussions on reformulation, front of package labeling, and such. With respect, in my opinion, we don't have enough push from the public itself. The civil society and NGOs are definitely doing their part. Heart and Stroke Foundation, which Professor Hassel will tell you about, the Healthy Caribbean Coalition, all of these members have been playing a part in getting the message across. We have been implementing the school nutrition policy, which not only involves diet, but also exercise. So certain things, I think the challenge would be to engage the stakeholders into what we want them to do as a government in terms of reformulation and taking the advertising away from children in terms of their package labeling, in terms of their placement within the supermarkets and shops. These are things we want to look at. So coming out of the meeting, hopefully in another 2 weeks, we should have something positive, I hope, to say and to report back.
Thanks so much, Minister. And at this point, before we go to the panel, let me try again with Feng Zhao from the World Bank. Are you on, Feng, and would you like to share an intervention with us?
Yes, thank you so much. Can you hear me well?
We can hear you perfect.
Apologize, my flight got delayed, so I'm still in the car. But I really keen to join, and this is NCD. It is a passion. It is also a priority area of the bank. Let me just quickly maybe touch on 3 quick points. And listening to other panelists and Honorable Minister was really exciting. My first point I want to touch on is we once again will the health is at a critical juncture, right? So the pandemic is not passing us yet. The PPR, the pandemic preparedness and response agenda, is really taking off both at global level and the country level. And yet the UHC agenda is coming back very strongly, strengthening primary health care, strengthening the entire system. And you can see NCD cut across in both agenda, both for pandemic preparedness. How do we make sure the system is not only resilient, but also responsive, particularly addressing the high-risk informations. We learn a lot from COVID, and NCD and pandemic go hand in hand. We will have to take that opportunity to make sure NCD is a part of the pandemic preparedness agenda. In the second area on universal health coverage and strengthening primary health care, this is a great opportunity for NCD to be part of it. In many countries, somehow NCD is not firmly into the PHC agenda, which is really a waste of resources. But I also see very exciting development in many countries, those high impact, highly cost-effective NCD interventions like screening, like community-based management are really taking off. Let me just give you an example. I was in Bangladesh in the past few days. Bangladesh is prepared its 5th health sector swap. We are actually prepare a 900 million project to support them. NCD will be a big part of this big swap and also big part of the bank financing. So that's one thing I think we should be very proactive to make sure NCD is both in the pandemic agenda and also in the UHC and system strengthening agenda. So that's my first point. My second point is we have to really take on country level innovations. There's many innovation already happening in different countries. Just by gather them and cross-share them will really serve as a global public good. You know, listening to the honorable ministers, many things has been taking place at the country level. We really need to systematically gather those. I also, you know, from the World Bank point of view, I really want to urge Ministry of Finance to be part of this conversation. Financing NCD is an urgent task. NCD has been systematically and seriously underfinanced, although it is the #1 disease burden and #1 killer in most of the countries. So that's the one area we will have to work on more. My last point is NCD is complicated, right? So it has set of risk factor attached to it. So health sector alone will not get the job done. So we'll have to engage with many other sectors and community. The minister mentioned the taxation program, which will require many other players to come in play. So that's a concrete example. At the World Bank, we really want to prioritize NCD both in our pandemic preparedness program, but also in our UHC health system strengthening program, and looking forward to continue work with Bente and the WHO and the NCD Alliance and other partners. We are highly committed to this agenda. Let me stop here. Thank you so much, and sorry for the inconvenience.
Thanks so much, Feng, for joining from the car, and really great to have the World Bank's perspective. And thanks also for raising those two really important kind of opportunities of integration, you know, obviously building off COVID and the PPR agenda, as well as universal health coverage. And I think, you know, it would be great for us to really be thinking through how this global group of heads of government and heads of state could really be supporting that kind of integration at the highest level with, for example, the high-level meeting on UHC coming up just next year as well. So thank you again for joining us in transit. So now let me bring in our second panel to really reflect on the example from Barbados on taxation, as well as their own thoughts around the global group and the Global Compact. So for this part of the programme, we are joined by Sir Trevor Hassell, the President of the Healthy Caribbean Coalition, Vanessa Perbety, who's the Deputy Director at IFPMA, as well as a member of the steering committee of the Coalition for Access to NCD Medicines and Products, as well as Nick Banatvala, who is the head of the Secretariat of the UN Task Force on NCDs, and obviously the newly formed Health for Life Fund, as well as Senator Guido Garadi from Chile, who is a physician, a senator for the city of Santiago, and a very long-standing champion of NCDs, and particularly prevention policies and nutrition policies. So thank you all for joining us. Let me come first to you, Sir Trevor. We obviously heard from the Minister another fantastic example of leadership coming from a Caribbean country, Barbados, but we all know that the political leadership for NCDs really started with CARICOM and has continued to from the port of Spain to today. And HCC, the Healthy Caribbean Coalition, has been accompanying that and supporting that political leadership. Could you share some examples of what HCC has done to really kind of support that political momentum, as well as accountability for progress within the region?
Sure. So thanks very much, Katie. And as you said, in many respects, it all really started in 2007 with that seminal meeting of heads of state of government of the Caribbean who met to discuss NCDs. And at that meeting, they spoke, in fact, and recognized the need to engage with civil society. And so when the Healthy Caribbean Coalition was formed a year later, our mission statement included and identified very specifically that we would be engaging in the multi-sectoral approach in support of government NCD plans in the Caribbean. So what have we been doing since that time on a regional and to a lesser extent, a national basis? Well, against that background then, the first thing we engaged with the ministries of health and their NCD focal points and entities which provide technical assistance and support, including UN agencies, regional public health organizations, and academia, so as to raise the priority and assist with the fulfillment of commitments for NCD prevention and control. So that was the first, that's been underpinning a significant relationship with ministries of health and platforms for implementing NCD plans and programs. That approach has in fact led to agreement of a major national and regional policy among Caribbean member states titled Promoting Healthy Diets, Food and Nutrition Security to Combat NCDs, Child and Adolescent Obesity. Some of you may have heard of this. It's the so-called CARFA 6-point policy, which calls for mandatory food labeling, nutrition standards and guidelines for schools and other institutions, food marketing and portion sizes, nutritional quality of food supply, trade and fiscal policies, and food chain incentives. So that really is a very important sort of collection, if you will, of policy imperatives that governments of the Caribbean are committed to. HCC has also engaged with governments by creating enabling environments for governments to implement their national and regional NCD plans, using, in fact, different strategies. And one of the most important, which we've used, is campaigns aimed at focusing on a specific aspect of national and regional NCD plans. So for example, we are currently engaged in a digital campaign titled Act on Facts, The Food in Schools Matter. This encourages public and policymaker support for the introduction of healthy school policies. Before that campaign, we also launched a campaign titled Make It Make Sense, very catchy sort of theme, a regional campaign to build public and policymaker support, highlighting the harmful effects of ultra-processed foods and the potential harmful impacts of industry on making healthy food policy. Now, in providing this support, HCC has over the years expanded and diversified civil society engagement by including the voice and views of groups such as people living with NCDs, people living with mental health conditions, and the youth. And we've aligned the NCDs with climate change and integrated them into the NCD and universal health coverage and access. This engagement in the Caribbean has contributed to the determination of a smoke-free Caribbean, an agreement to eliminate trans fats in the Caribbean, greater focus on mental health, and an increased conversation on cervical cancer elimination. But what of accountability and accounting? In this regard, the HCC has contributed to regular monitoring and implementation of the mandates of the heads of government and state meeting that I referenced earlier. And also, we've supported the global monitoring framework for the prevention and control of NCDs as part of an ongoing assessment of implementation and prioritization of interventions by Caribbean member states. But I want to conclude with 5 specific asks, because I think that was what in your introduction you invited us to do. And so my first would be that heads of state and leaders should recommit to their recognition of the role of civil society in NCD plans and programs. Secondly, that platforms for more effective engagement between national heads of state and leaders of governments and civil society. There should be more effective programs, platforms. Thirdly, that they should explore ways in which civil society might more effectively support governments. Fourthly, that heads of states and governments in the Global Compact going forward should expand and diversify civil society engagement so as to embrace and align with climate change, universal health coverage, people living with NCDs. And finally, a fourth is that there is a role for civil society to contribute to the monitoring of progress in NCD prevention and control. And I think more can be done in this area. I want to conclude these brief comments by placing on record, because I think it is appropriate, and this is an appropriate juncture to do so, to recognize the role that the NCD Alliance has played in contributing to the Healthy Caribbean's coalition involvement in this arena over the more than a decade. I think this has been excellent, and I would wish us to see these initiatives and commitments and achievements by the Healthy Caribbean Coalition to be but a reflection of the significant commitments and work of and leadership of the NCD Alliance. Thanks a lot.
Thanks so much, Mr. Trevor, and thank you for thank you for your clear call to action in terms of those 5 asks, but also I think from my perspective, also just really reinforcing the role that civil society can play in monitoring and accountability. I think that's definitely an area from my own perspective that remains fairly untapped in terms of the NCD community. And there are huge amounts of lessons that we can learn from other global health and development communities, just like HIV/AIDS, with a huge focus on community-led monitoring, as well as shadow reporting, so that when we get to these big UN high-level meetings, we have that counter perspective and complementary perspective from civil society on what's working and what's not working, as well as the more official responses from governments. I'm conscious of time, so I'm going to keep moving through our panelists, and I'd like to now pass over to Senator Guido Gerardi, who's joined us from Chile. And I'm sorry that we haven't been able to offer interpretation, but he's kindly offered to speak in English for us. And many of us are very familiar with Senator Gerardi as a real champion for NCDs and the fantastic work that Chile has done in terms of implementation of front of pack labeling. So over to you, Senator Gerardi, for your intervention and remarks.
Thanks. I apologize because my English is not very well. I speak French and Spanish, but there are a lot of issues that are very important to us. First, that is the obesity is the most important pandemic in the world. But the problem, it is silence, a silence pandemic. It's an invisible pandemic. And we are accomplices in that. The obesity kills more people than coronavirus. It's difficult to understand why in the world we are not doing the same that we are doing in the coronavirus. The obesity kills more than 41,000 people in the world every year. And it kills young people. It kills almost about 10 million people who are young, who are between 40 and 60 years. The second thing that is very important, I think that is very sad that we continue to call non-communicable disease. It's false, it's a fakes. They are the more communicable disease. And I think that we are all accomplices when we continue to talk and say no communicable disease. It's not true. They are the most communicable disease, but if we continue to talk about no communicable disease, we have nothing to do. It's true, we have all to do, because it communicates about the neuromarketing, about the advertisement, and we must cut the advertise. Also, these industries are doing a violation of the human right, because they are using false advertising to children. And also, we cannot continue to call food something which is trust. It's not food, it's trust. For example, this cereal from America, very famous, it has 48% of sugar and more than 700 milligrams of salt. That is not food. It is trash, it's waste. But why we continue to call that food? And what we do in Chile? First, we want to have the right to know. It's a human right, the right to know what is inside. When people see so that, it thinks that it's a healthy product, you know, but it's not a healthy product. What we do a human right is the right to know. You know, you had the black label, frontal black label. Even children can understand that is high in sugar, high in calorie, high in fat, and high in salt. And what is important, if you have only one, you cannot have TV advertise, you cannot have advertise in internet, you cannot have animation, you cannot have, for example, the buys from the state, you can sell that in a school. But if the industry go down with the sale, the calories and the sugar, and they put out this black label, they recuperate the possibility, capability to have advertised, you know. And what happened in Chile? We have about 25% of all the products who are now they are healthy. Before they were junk food, now they are healthy. And that is, we need to do. It's very important. We do this law in Chile in 2011. We export this law. I went to Peru, to Argentina, to Colombia, to Mexico, to Uruguay, all the country. We have this law now. But it's impossible to do that in Europe. Europe is captured by the industry. And the industry, what they want? They want the the traffic light. Why? Because when we discuss about the frontal label, the black frontal label or the traffic light, we did a focus group with children, and the children said us that they understand the black label, and no, they didn't understand the traffic light. But the industry, what the industry want? They want something that nobody can understand. And they don't want that people could have the right to know. And now what we are doing, we're doing tax to, well, we did tax to sugar beverage. We're proposing to tax all the product which has 1 or 2 or 3 or 4 black label. We are doing a green card because it's a problem, it's a social problem. Poor people are obese and are obese with undernutrition. They are both undernutrition and they are obese. And we are pushing a green card to poor people, and only to buy fruit and legumes are only in market. And also we are doing a law to make the obligation to do 1 hour exercise in all the school. And I think that we need to work together, but the most important, we must make to be visible this pandemic. Now it's not visible, and we are accomplice, and we must change the OMS, the WHO must change the definition. The definition is very, very important. It's true, it's a fake, it is not a non-communicable disease. We cannot continue to be complice. We must change. They are the more communicable disease in the world, because it's a business, and because we don't make people become healthy. We give them palliative. It's a very huge business that people continue to be obese. We give them atorvastatin. They have hypertension. They have upper pressure. They have diabetes. It's a very good business, and we must do healthy and not business in the world.
Thank you so much, Senator, and your English is excellent and far better than my Spanish. So thank you so much for providing your intervention. And it's such an inspiring example of what's happened in Chile. I mean, the front of pack labeling example now being rolled out in many other countries, and the way that, you know, a country can focus on one specific nutrition policy as a kind of the beginning, and then build in a more comprehensive approach around some of the other best buys. So thank you so much for that example. In order to keep things moving and reflecting on the time, I'd like to now pass over to Vanessa at IFPMA, and obviously a member of the coalition. Obviously the coalition was really kind of started with this very true kind of focus on multi-sectoral action around issues of access and supply chain in low and middle income countries. So if you could share some examples of the coalition's work at the country level, as well as recommendations for this global group. Over to you, Vanessa.
Yeah, thanks so much, Katie. And yeah, Senator Guido is indeed a hard act to follow, but I will go back a little bit towards what Sir Trevor was talking about in terms of the progress and the impact that coalitions can achieve. And I want to spend a bit of time to talk about the role of the Coalition for Access to NCD Medicines and Products, particularly as it relates to Commitment 3, which is about covering all people by 2030 with quality essential health services that are safe, effective, affordable, and essential. Basically, I think, we all know that approximately 50% of those in LMICs are unable to access the NCD medicines that they need in order to prevent complications and early death, and that the NCD medicines constitute a much greater proportion of out-of-pocket costs than almost any other disease area. And indeed, that government leaders, health providers, and other stakeholders really do lack the tools that they need and the capacity to provide adequate care and follow-up. And I think it's in this respect that, the vision and the mission of the coalition is worthwhile reminding folks about, because it really speaks to that. So the vision of our coalition is that all people living with NCDs in LMICs have access to the affordable basic technologies and medicines that they need. That includes generics, which are required for diagnosis and treatment in both public and private facilities. And our mission is to advocate and provide technical support and tools to strengthen supply security for people living with NCDs. So over the last 5 years, we just celebrated our anniversary, which is lovely to meet up with people after a long breakaway with COVID and whatnot. We really kind of revisited what we've been able to achieve over this time. And we've contributed at all 3 levels globally, nationally, and regionally, with contributions not just on advocacy, but also very importantly on our NCD forecasting initiative, which has been implemented in Kenya and Uganda, and really brought together global expertise that's been kind of, brought together by this diverse group of stakeholders through webinars, through conferences and blogs and publications. And I think Dr. Francis Moreau, who leads, at the Ministry of Health in Kenya on NCDs, he really puts it very well and has spoken a number of times on the benefits that this forecasting tool and initiative has brought at country level. And in Kenya, they, with the help of the coalition, they managed to achieve their first 5-year costed county forecast for hypertension and diabetes medicines for the country, and quantified the gap between supply and demand, which has really raised the profile of the gap in access to medicines at the regional and national level. And I think this is something we really can't underestimate. I think more often than not, countries aren't able to quantify this gap between supply and demand, and often don't have a clear idea of what they need with respect to forecasting when it comes to NCD meds. So this has been tremendous progress from the coalition. And more recently, we've tried to kind of expand our voice and bring the voice of the coalition forward in a number of venues, whether it's been the global dialogue on financing for NCDs, or the Global Diabetes Compact, or indeed the private sector dialogues that we've had, and I've been a part of with WHO. I think we've had 3 of those now over the last few years, as well as providing input into the WHO supply chain roadmap. And I think, just to speak personally in terms of, having been with the coalition from the very start and coming from the private sector side, for me, the coalition remains really important in terms of being the only true multi-sectoral voice that kind of is coming together with a common mission and vision that we all believe in to improve access to NCD medicines and products. So I think, with the focus work streams that we have on advocacy, on finance, supply chain strengthening, and capacity building, those are really the concrete areas that we think are the ones that move the needle when it comes to improving access, affordability, and availability. And we hope that we can build on the momentum that we've seen with the NCD Compact and the Heads of State Group and move from strength to strength. So I just want to thank you, Katie, and the rest of the gang on this call for the opportunity to talk a little bit more about the coalition and hand it back to you. Thanks.
Thanks a lot, Vanessa, and thanks for sharing that, the concrete example of the forecasting tool, which is, fantastic to see. And Minister Brown, apologies, I missed your hand. Are you wanting to come back in now?
Just quickly, I just wanted to congratulate Senator Guido. I had the opportunity of hearing his presentation not so long ago in Geneva, and I think it's very inspiring. The problem we have as a small destination, though, a small region, is the impact that I don't know that we have as much of an impact on the suppliers as much as South America does because of its size. So any advice on that end would be, I keep asking for it, I would be grateful for. So that's just all I wanted to say.
Thank you, Minister. And I think I'll come to our last panel speaker, and then we can do a quick round and reactions at the end there. But let me come to you, Nick, our last panel speaker. Obviously, I think one of the specific areas of the compact is invest, and we've seen over the years that this has been a little bit of an Achilles heel in the NCD response, lack of funding. And I know you've been doing a lot of work with the Multi-Partner Trust Fund, Health for Life Fund, to really try and change this. So over to you in terms of your experiences and lessons learned, and any calls to action for that global group.
Thanks a lot, Katie, and I love your British understatement of we've had a little bit of trouble with identifying funds for NCDs. Hello, everyone. Yes, indeed, investment's one of the concrete actions of the NCD Compact and the UN Multi-Partner Trust Fund to catalyse country action for NCDs and mental health, to give it its full name, but commonly known as the Health for Life Trust. Established last year by WHO, UNDP and UNICEF, is indeed highlighted in the compact as a mechanism to deliver adequate, predictable and sustainable resources for prevention and control of NCDs. And if I can quote from the compact, I've got here the recently established UN Multi-Partner Trust Fund is one of the global financing partnerships to support low middle income countries mobilize domestic resources and to scale up action. And as Fane just said just a few moments ago, financing for NCDs and mental health conditions is woefully inadequate. But it's worth reminding everyone that in addition to supporting action under investment, Health for Life actually cuts across a number of the other areas of the compact, including accelerating country action. So Health for Life providing catalytic funding to support countries scale up and accelerate action, clearing bottlenecks, if you like, which impede progress. Aligning by committing funds to support the strategies and plans of countries, but also harmonizing action through joined up UN and wider development assistance responses, and then engaging, because the fund isn't just a UN system mechanism, but also working with governments, academia and NGOs, philanthropists, so on and so forth, as well as people with lived experience of NCDs and mental health conditions. So let me very briefly tell you a little bit more about the fund for those of you that are not fully aware. It responds to country demand and was established in response to a number of UN General Assembly, Economic and Social Council and World Health Assembly resolutions, as well as a recommendation of the WHO Independent High-Level Commission on NCDs. And if you're not too embarrassed, Katie, once again, you as a commissioner, thanks very much for all your work on that commission. Then the fund builds on the work of the UN Task Force on NCDs and its members, with needs identified in joint programming missions that were done to loads of countries and outcomes of a large number of country-led investment cases. Number 3, C, Health for Life has 3 founding strategic partners, Kenya, Thailand, and Uruguay, and Chile's been recently very involved and interested in this. Demonstrates the leadership for the fund coming from the South, and that the principles set out in the terms of reference, including being country-led, catalytic, cross-sectoral, country-driven, etc., are all adhered to. The next one is that the fund is engaging with civil society. 2 NGOs are currently part of the steering committee, and the expectation is that proposals will be developed in country with the inputs of civil society. The fund's aiming to raise around $250 million US over the next 5 years, an amount that's probably appropriate for the first phase of a fund that is catalytic, rather than, if I can say or describe, as a global fund in nature. And this is how it should be. After all, Health for Life, it's aiming to mobilize rather than replace domestic responses. And then safeguards with regards to conflict of interest for the fund are in place. And Patty, I note that you highlighted the importance of this and have done continuously throughout the chat when it comes to partnerships. So Health for Life is using the same approach as many other multi-partner trust funds. This approach, multi-partner trust funds, were developed by member states to pool funding for countries. And this approach has been shown in evaluations to be both effective and efficient. So excitingly, a number of partners have announced commitments to mobilize resources for the fund during the recent UN General Assembly high-level week, but the fund is looking for more partners to join and shape the way that it works in its startup phase. So let me conclude by encouraging those of you here today who would like to know more to get in touch with the Health for Life Secretariat. And moreover, let me encourage the global group of heads of state and government for the prevention and control of NCDs, and all those driving forward the compact to join forces with the Health for Life Fund. And finally, that the fund is included in the preparatory discussions ahead of the 4th high-level meeting on NCDs in 2025, including the milestones that have been described in today's notes. So thanks a lot, Katie. Back to you.
Thanks a lot, Nick. And yeah, great to hear about the Multi-Partner Trust Fund and the progress that's being made. And I think we've also heard, obviously, over the last couple of hours, other examples of kind of how we can fill the gap in financing. And the example of sugar sweetened beverage taxation is another kind of key mechanism and policy for resource mobilization as well. In terms of final interventions, I have one more person to call upon. Really pleased to invite Charity Maturi, who I think is online. I can see, yeah, there we are. Fantastic. Thank you, Charity, for joining us, who's involved with the NCD Alliance Kenya and is a member of the advisory committee of Our Views, Our Voices. Over to you, Charity, on, I imagine you'll be focusing around kind of the importance and role of people living with in terms of engagement. So over to you.
Okay, thank you very much for this opportunity. It is a very exciting one. I am very happy to hear of the wonderful things happening in Ghana. I'm very challenged by the examples of taxation from Barbados. I think I have been a champion of meaningful involvement, and especially moving from tokenism to sustained efforts. So I think for me, meaningful involvement means patient leadership, because it may mean different things to different people. But for me, it's patient leadership from strategy, implementation, monitoring, and evaluation. And my role is to give some examples from Kenya. I know I've given a lot of examples of myself being in the task force on mental health, currently in a court case decriminalizing suicide with Kenya National Commission on Human Rights and Kenya Psychiatric Association. But I also want to give examples of NCDs because we have been involved in the Kenya strategic plan and we added a lot of value to that. And I look at that as a long-term policy. In terms of advocacy, Kenya has been involved in the NCD interagency committee where persons with lived experience have led in advocacy. And very interestingly, in terms of disaster response, because probably when we talk about policies, we assume they are long-term. But when COVID hit, immediately our Ministry of Health put together an NCD COVID subcommittee, and we were brought in as patients representing different illnesses or diseases. And in real time, we were able to address that. So I think that disaster preparedness, as we look forward, as we prepare for the future is important. And currently, we are working on a framework of support groups, patient support groups across the country, what that should look like. And so I'd like to challenge our heads of state that when we talk about lived experience, we are not asking to have warm bodies on the seat. We will add value because the value that we have added so far, even in mental health, has given us opportunities that we've not had to fight for. We add value and we are called for committees. We are now in 7 health committees in the country. So my call is to include us not only in policy, but also implementation, monitoring, and evaluation through a rights-based approach, but also for cross-cutting policies, because NCDs are cross-cutting, as has been mentioned by various panelists. And lastly, to say that especially for disability, which is very expensive to manage for a country in terms of welfare and in terms of management, since NCDs are the leading cause of disability, investing and including us in prevention will also contribute towards preventing the high costs of disability management. Thank you.
Thanks, Charity. And I think, yeah, your point, particularly on the value that people living with NCDs bring to these discussions, is really important. We're not just talking about meaningful involvement for the sake of involvement. It really provides kind of rich expertise and perspectives on how we can shape policies and programs and services and targets to actually meet the needs of people living with who this is all about. So thank you for those examples. Given time and the fact that we're over, unfortunately, we're not going to be able to go back to the panel for a further round of questions, but I would really like to thank everybody for your questions and your comments in the chat. And we've been trying to kind of respond to as many of those as possible in the chat box. As well as thanking our panelists and our speakers today, we've obviously had a very rich and packed programme with lots of different perspectives on examples of what's working in terms of multi-stakeholder responses, how different stakeholders are already taking forward those 5 action areas within the Global Compact, as well as rich ideas around the global group of heads of government and heads of state and how we can really utilise that group going forward in the lead up to the 2025 high-level meeting. And I think some of the key points that have come out for me are, first and foremost, the importance of having political will and leadership at the highest level in NCDs. It's always so important. And so that global group does provide us with a fantastic opportunity. Also, the fact that throughout these conversations, we've really seen how different multiple stakeholders are working on NCD prevention and control, and that different stakeholders are playing different roles, from relevant private sector, but with particular safeguards in place to manage conflicts of interest, people living with NCDs and civil society, academia, foundations, all playing a role. So now let me pass over to Bente Mikkelsen, who will be wrapping this up for us and sharing her own reflections on the conversation so far. So over to you, Bente.
Thank you very much, Katie. And I think the pure fact that we are partnering in this journey together, NCD Alliance and WHO, is for me sort of a safety guard. It's reassuring, and I hope it will also inspire that we can do this at global, regional, and country level. And I support also all the kudos to NCD Alliance, who have been a driving force. But I would also say, you know, all the voices from different corners, from the people living with, from the policymakers that really wants to do good, but which don't always know where to start and which tools to use. And also our ministries of health that we meet every year during the executive board and the World Health Assembly. So I think we have to realize that the journey is not over. It's almost only begin. And I think what is the opportunity, and this is coming back to what I have sensed during this very, very rich conversation. What I sense is really the energy. It is the will to change the world when it comes to NCD. And I think for me, what is standing out is Chris, who said it's the life that matters, and also the story that we started the day with from Poonan, and her actually call for leadership. Your point, I think, was that we need to learn to raise the voices, but also that is not enough. There is a need for leadership. And I think that's where we all come in. So if we think about it, we have a golden opportunity. It's coming from a rather challenging situation. During COVID, the excess mortality tripled. We know that most of those mortalities came from the so-called underlying diseases, namely NCDs, but so do actually also the ministries of health. After listening to the regional committee meeting in Afro, this is the first time where I was listening to leaders in Afro, fully realizing their challenges on HIV, TB, and malaria, but also more and more speaking about the tsunami that they know experience also on NCD. So I think we have a window of opportunity. We also have a window of opportunity because we have the mandate from the World Health Assembly now to prepare for the next high-level meeting. So in your concept note, you have already seen that we are preparing now for 2 meetings in the SIDS. And thank you very much for Barbados and Minister Brown for hosting this. These are golden opportunities. This is coming back to the leadership that was already starting in the Port of Spain, Samoa Pathway, several years ago. And now the SIDS countries want to raise their voices and take the leadership again. It will be followed by a ministerial conference. And of course, all of this will be with multi-stakeholder engagement. We also have very important initiatives and a global high-level meeting on NCD and emergency coming up in 2023. We will do more for NCD and financing. And thank you, Nick, for telling us about the Multi-Donor Trust Fund and all the opportunities that is linked to that. And we will also be able to provide, if we are clever, language into UHC high-level meeting happening in 2023. I'm so happy that most of you are talking about integration in a way that is not only iconized. You are talking about integration that needs to happen at primary healthcare level, including the access to medicine, including the access to a well-trained health workforce. So I think our understanding of what does it really mean to strengthen health, the primary health care and the health system at large, and the need to protect people financially through inclusion to UHC, but also to build the preparedness for any new emergency, and preparedness is really a red thread coming through the meeting. I am so happy that we recorded this session, and I must say the senator Your intervention on obesity is really powerful. I can tell you, and you know probably as well, that we have now an acceleration plan approved by the World Health Assembly to stop obesity. So it's recognized by the member states, and I think it was in due course, and it was probably overdue as well. So I want to end up with reminding us of two things. We have the power to influence, but also to support our heads of states, our governments. We do that every day. We can do that every day at a national and also global and regional level for the governance structure happening there. The golden opportunity that is in our hands now is to try to fill the gaps, to provide the mandates and the language, not only for 2030, but actually vision towards 2050 through the next high-level meeting. But as important, and many of you have talked about that, is the reason why the member states also approved an implementation roadmap in this year's World Health Assembly. They wanted to accelerate the national response. They wanted to ask countries to prioritize and scale up. And they really put the emphasis of data. And thank you very much for those who spoke to data and the use of data today. So this, in combination with the NCD Global Compact, gives us the opportunity. And I think next time we meet, we have to even focus more on how can we commit, how can we align, and how can we focus to make this happen. Thank you very much. Thank you very much for an excellent moderation during challenging technological environments, Katie. And I apologize that our interpretation fell out in the last minute. And thank you very much to the World Bank being there on the road between several important destinations. Thank you to youths. Thank you to people living with. Thank you forever for Sir Trevor's very wise words, and also for demonstrating what can happen when people come together. Thank you very much, everybody, and have a fantastic day.
Thanks a lot, Bente, and thanks everyone for joining. It's fantastic to see 100 people there at the end with half an hour over. So thank you, everyone.
Thank you. Thank you, everyone.
And thank as always to the team of WHO. So I don't want to mention everybody. I say Guy and Temo, and then it's 20 more people behind them. So thanks a lot.
Many, big team. Thank you, everyone.
Thanks very much, everyone.
Good rest of the day, weekend.
Yeah.
Take care. Bye-bye.
Thanks.